Hello everyone, my name is Dr. Jeff Brown. This video presentation is designed to address your concerns about tests and exams that you might encounter in the veterinary reproduction course. I'm afraid I've got a little bit of a cold at the moment, so if it sounds like I've got a blocked nose, it's because that's exactly what the issue is. Veterinary reproduction is a wide discipline with many tricky concepts to get your head around. For those of you who are good at short-term memory recall, I'm afraid I've got some bad news for you. That's not how an applied discipline like reproduction works. While rote or parrot fashion learning can help you to memorize the fundamentals, animal reproduction is an applied science that takes your knowledge of anatomy, endocrinology, pathology, pharmacology, as well as animal husbandry and herd health, and mixes it all together in a complicated stew. Somehow you need to figure out what's important and how each aspect fits in. You need to spend time, and I mean many hours with the work, wrestling with the concepts, until eventually they become second nature and you can apply them to completely new situations. As clinical veterinarians, you will very seldom be required to recall lists from memory. Rather, you will be presented with a challenging new case that requires you to extrapolate what you already know and follow a logical series of steps based on your training right here at vet school. I recently saw one of those cheesy motivational posters that had a picture of an exhausted marathon runner on it, and the caption said, "If it doesn't hurt you, it can't change you." Now, I normally can't stand those sorts of things, but this one really made me think of my students struggling with the concepts, just as I once did. Remember those words when studying, and just keep on trucking. The aim of this presentation is to help you to understand what level of knowledge it is that we expect of you. I want to show you how you can expect us to pose questions and to get a feel for the general format of the questions. I also want you to take note of how we expect you to think things through. Just because we might have computer-based multiple choice questions doesn't mean that you will be able to pass the test by picking the answer that looks right. Our questions vary in the level of reasoning required. Some may be simple recall, others may require quite a lot of thought and logical deductive reasoning. Usually the mark allocation gives you some idea of the amount of thinking that's required. If you have what appears to be a simple multiple choice with one correct answer, and that answer is worth more than 1 mark, be extra careful and make sure that you put adequate thought into your choice of answer. It's very important for us that our tests are neither too difficult nor too easy. Your lecturers and clinicians in reproduction are all experienced veterinarians who have worked in private practice as well as in the academic hospital. We have seen how real-world cases are presented. We therefore try to make sure that our questions are realistic and reflect situations that you are likely to encounter when you're grown up and out in the world. Question 1 for 1 mark. Question 1 is very basic and tests your knowledge of the AM-PM rule at a very low cognitive level. You aren't required to do too much deductive reasoning, you just have to remember the AM-PM rule and eliminate the incorrect answers. This is why this is only a 1 mark question. We would expect 90% of the class to get this question correct. In a dairy herd, cows are observed for estrus behavior for 20 minutes twice daily at 6 a.m. and 6 p.m. When only 1 semen straw is available per estrus per cow, the best time to inseminate is A. Immediately when estrus is observed, B. 2 hours after the observation of estrus, C. 4 hours after the observation of estrus, D. 12 hours after the observation of estrus, E. 24 hours after the observation of estrus. So the question specifies that a single straw is available. This fact suggests that the semen is valuable. If the semen is so valuable, then one of the most important things to do is to get the timing of insemination right. The AM-PM rule is based on experimental evidence that has shown that the best fertility results when the cow is inseminated 12 hours after the onset of standing heat. Therefore, the correct answer is option D. Question 2 for 3 marks. In vitro embryo production has the following 3 recognized advantages over multiple ovulation embryo transfer. A. Less equipment is required for in vitro embryo production compared to multiple ovulation embryo transfer. B. Less technical skill is required for in vitro embryo production compared to multiple ovulation embryo transfer. C. Superovulation is not required with in vitro embryo production. D. With in vitro embryo production, embryos can be produced from a pregnant cow. E. A single cow can produce more embryos over her lifetime by in vitro embryo production than by multiple ovulation embryo transfer. F. Higher pregnancy rates are achieved from in vitro embryo production derived embryos. G. Better quality calves are produced from in vitro embryo production compared to multiple ovulation embryo transfer derived embryos. This question is at a slightly higher cognitive level than question 1, but it is still fairly basic. It requires you to recall your knowledge of 2 embryo transfer techniques, and then to decide which of the options from the list are applicable to each. Let's see which of the responses we can eliminate. Option A. Less equipment is required for in vitro embryo production compared to multiple ovulation embryo transfer. For in vitro embryo production, to collect the oocytes we need an aspiration probe with an ultrasound machine, as well as vacuum pumps, tubing, aspiration media, as well as epidural anesthesia for the cow. To find the oocytes we need an embryo filter, stereo microscope, Eppendorf pipettes, and transport media to put them in afterwards. To fertilize the oocytes, we need fertilization media as well as fertile sperm. To grow the embryos, we need a CO2 incubator, petri dishes, and maturation media. Then, to transfer the resulting embryos, we need embryo transfer pistolets and a recipient cow that's been synchronized so that a stage of diestrus is known. For multiple ovulation embryo transfer, you take several cows, synchronize their cycles, inseminate them using a bull or by AI, then flush the embryos using Foley's catheters, flushing media, and embryo filters 6 to 8 days after breeding. You then grade the embryos and cryopreserve them whilst you transfer them directly to synchronized cows in diestrus using an embryo transfer pipette. So as you can see, far less equipment is required, and we can eliminate option A. Option B. Less technical skill is required for in vitro embryo production compared to multiple ovulation embryo transfer. As should be obvious from the previous option, both in vitro embryo production and multiple ovulation embryo transfer consist of multiple steps, all of which require substantial technical skill. However, there are many more steps in vitro embryo production, and the successful fertilization of embryos in the lab adds substantially to the level of skill required. So we can eliminate this one. Option C. Superovulation is not required with in vitro embryo production. Remember, in vitro embryo production aspirates oocytes not only from the dominant follicle, but from subordinate follicles as well. Therefore, yes, superovulation isn't required. This is one of the major advantages of in vitro embryo production over multiple ovulation embryo transfer. Superovulation agents are expensive, and cows can develop immune responses to the agents which decrease their efficacy. Option D. With in vitro embryo production, embryos can be produced from a pregnant cow. Well, with in vitro embryo production, you are aspirating oocytes straight from the ovaries. Even though ovulation doesn't occur when a cow is pregnant, she still undergoes follicular waves, where follicles develop to antral follicle stage and then regress again. Therefore, as long as you can palpate the ovary, you can aspirate potentially fertile oocytes. With multiple ovulation embryo transfer, remember you are advancing a catheter into the uterus. Obviously, you can't go pushing catheters into a pregnant uterus. Therefore, this is a situation where in vitro embryo production holds a significant advantage over multiple ovulation embryo transfer. Option E. A single cow can produce more embryos over her lifetime by in vitro embryo production than by multiple ovulation embryo transfer. Remember, with in vitro embryo production, we can aspirate every 10 to 15 days or whenever the cow develops a new follicular wave. Depending on the cow, each attempted aspiration can result in between 3 and 15 or more oocytes. With multiple ovulation embryo transfer, we can only collect once every few estrus cycles after synchronizing her by regularly injecting her with superovulatory agents and then breeding her. Each attempt at collection may only result in 3 to 12 embryos, occasionally more, and continuous exposure to superovulatory drugs can result in waning fertility after several rounds of embryo production. Despite the fact that one usually gets better embryos using multiple ovulation embryo transfer, the fact that in vitro embryo production can be done so often to the same cow results in a better lifetime production of embryos per cow. Option F. Higher pregnancy rates are achieved from in vitro embryo production derived embryos. With in vitro embryo production, we are aspirating oocytes and maturing them in a laboratory before fertilizing them, and then growing the embryo to the 6 to 8 day stage. With multiple ovulation embryo transfer, the cow does all of this for you under the optimal conditions found in her fallopian tubes. We certainly can't mature oocytes and grow healthy embryos as well as she can. So when evaluating the success of embryo transfer, we refer to pregnancy rate as the number of pregnancies obtained per the number of embryos transferred. Lab-grown embryos obtained from in vitro embryo production programs die more easily than those flushed from cows during multiple ovulation embryo transfer programs, so this is wrong. Option G. Better quality calves are achieved from in vitro embryo production compared to multiple ovulation embryo transfer derived embryos. In general, the quality of the calf is determined by genetics and the health of the cow whose uterus it develops in, so that's a no. Question 3 for 2 marks. The following are 2 recognized risk factors for the occurrence of repeat breeder syndrome in dairy cows. A. High milk butterfat percentage. B. Hypocalcemia. C. Younger cows. D. Long dry period. E. Lameness. F. Mastitis. G. Dystocia. H. Negative energy balance. Right, so what is repeat breeder syndrome in dairy cows? Before you can answer this question, you first need to have a good idea in your head what that is. Repeat breeder syndrome is the phenomenon of cows not falling pregnant despite everyone's best efforts. Remember, on a dairy farm, you want to get your cow pregnant as soon as possible after the voluntary waiting period. And if you can't remember what that is, please go and look it up right away. You need her to be pregnant so that you'll have enough replacement calves, and also because she produces milk at maximum levels relatively soon after the birth of her calf. We call this peak lactation, after which milk production steadily declines. So, in this question we are asking you what factors are associated with an increased risk of your cow not falling pregnant again after giving birth to the previous calf. Let's go through the options and see which ones we can eliminate. Option A, high milk butterfat. So what determines butterfat? I'm not an expert on dairy nutrition, but from what I've learned, butterfat is determined by genetics and by roughage intake. So let's eliminate this one temporarily and see if we can find 2 better candidates from the list. Option B, hypocalcemia. Well, you should know that hypocalcemia in cattle is a condition of the peripartal period, and repeat breeder syndrome is a condition encountered after the voluntary waiting period, which is 55 to 60 days after birth, so that we can eliminate this one too. Option C, younger cows. Well, in fact, repeat breeder syndrome typically affects cows that have had 2 calves or more, but for the purpose of this exercise, let's pretend we don't know that. Young animals include heifers, which should be very fertile and have minimal metabolic stress placed on them. Let's eliminate this one temporarily, unless we don't find any better ones. Option D, long dry period. Well, a long dry period should allow the cow plenty of time to recover her reserves before the next lactation, so therefore these cows are less likely to experience repeat breeder syndrome by this logic. Option E, lameness. Lameness is an issue on many dairy farms, but it's not associated with repeat breeder syndrome. Option F, mastitis. Mastitis is another condition that is an issue on many dairy farms, but mastitis doesn't have an association with the repeat breeder syndrome. You can eliminate that one. Option G, dystocia. Remember, a cow who has issues giving birth often has other complications downstream. She has an increased incidence of retained fetal membranes, endometritis, and occasionally also metritis. These conditions may affect the uterine environment and delay normal involution. This will lead to histological involution taking longer than the normal voluntary waiting period. Therefore, if she comes into standing heat and ovulates a healthy oocyte, even if the oocyte is fertilized, the conditions in the uterus are not yet ready to nourish a new embryo. We often get early embryonic death and return to estrus in these cases. So yes, dystocia is an important risk factor for the occurrence of the repeat breeder syndrome. Option H, negative energy balance. The condition of the cow during her dry period has a critical effect on the subsequent development of postpartum conditions. Dairy cows have been bred to produce large volumes of milk at the cost of other physiological processes, particularly reproduction. As milk production has increased significantly in the past 50 years, so fertility has declined. Cyclicity in cattle is affected by the activity of GnRH, which in turn is affected by nutritional state. If a cow is in a negative energy balance, she is less likely to have normal GnRH activity, and therefore less likely to have adequate FSH and LH secretion to support follicular development. In addition, involution is likely to be delayed, and there will be lower levels of circulating sex steroids. I'm not going to get into those mechanisms now, but all those are factors that contribute to the fact that a negative energy balance is a major risk factor for the repeat breeder syndrome. Question 4 presents you with two images side by side. You need to be able to identify that image A is of a cervicovaginal prolapse and that image B is of a full uterine prolapse. The fact that cotyledons are evident in image B should be a dead giveaway that this is the inside surface of the uterus that you're looking at. You then need to be able to match the statements with the appropriate image. I would say that this question scores around a 6 out of 10 on the trickiness scale. First, you have to identify what you're looking at from the images. Then you have to recall facts relating to the full uterine and cervical prolapse and not get them confused. The reason that I don't rate this one any higher on that scale is because once you've identified the conditions in each picture, you can use logic to work out which option applies to it. So let's look at our options. Statement 1 occurs prepartum. Well, if the uterus turned completely inside out as seen on image B in the prepartum period, then it would expel the fetus and rapidly become postpartum, wouldn't it? Statement 2. If any necrotic tissue is present, must be treated by amputation. So this one should be basic recall. You should know very well, because we've told you many times, that amputation of prolapses of any type, either cervical or uterine, is usually contraindicated, and that slaughter is usually the better option. I distinctly remember telling everyone that amputation of a prolapse is a bit of a cowboy maneuver, although we do it occasionally. Also, I remember telling you that necrotic tissue usually self-debrides. So therefore, the fact that any amount of necrotic tissue is present is definitely not a reason to amputate. Statement 3 is overrepresented in dairy breeds. Well, the pictures here happen to be of dairy cows, but no, neither condition is overrepresented in dairy breeds. Statement 4 is often associated with acute death. Remember, uterine prolapse is often associated with a rupture of the middle uterine artery, which can lead to acute death, particularly once you've just replaced the prolapse. Statement 5 is often associated with hypocalcemia. The association of uterine prolapse with hypocalcemia is well described. Statement 6 is caused by uncoordinated myometrial contraction. No, neither. Cervicovaginal prolapse is caused by pressure from the late-term fetus on the pelvic organs, causing the cow to strain and expel her vagina. Uterine prolapse is caused by uterine flaccidity in the immediate postpartum period that is associated with hypercalcemia. The cow continues straining until she expels the entire uterus. Statement 7 increases the risk of endometritis. Uterine prolapse increases the risk of endometritis because contamination of the interior of the uterus occurs in the postpartum period. We commonly see this. Statement 8 may increase the interval to reconception. So we've just discussed the repeat breeder syndrome, and as I said in statement 7, uterine prolapse may result in endometritis, which affects histological involution, thereby increasing the interval to reconception. Statement 9 is commonly seen after abortion. No, abortion has no association with prolapses of any type. Statement 10 may involve the urinary bladder. The urinary bladder may become entrapped in either type of prolapse, so therefore this is an important thing to bear in mind when resolving them. Question 5. A valuable Jersey heifer calf was mismated by a beef bull when she was 6 months old and weighed 180 kilograms. Rectal palpation and ultrasonography revealed that she is approximately 8 weeks pregnant. Select the correct treatment. A single injection of dexamethasone given immediately. B. 2 injections of PGF2-alpha given 11 days apart, starting immediately. C. A single injection of PGF2-alpha given immediately. D. A single injection of PGF2-alpha and a single injection of dexamethasone given immediately. E. A single injection of estradiol benzoate given immediately. F. Intracervical misoprostol given immediately. This question is designed to test your knowledge of pregnancy maintenance. We know that in the early part of pregnancy, the bovine conceptus is entirely dependent on the corpus luteum to ensure that pregnancy is maintained. The CL is the only source of progesterone. Therefore, if we inject the cow with PGF2-alpha, we will induce abortion. So let's look at option A, a single injection of dexamethasone given immediately. Dexamethasone works by simulating the fetal stress response and induces the conversion of fetoplacental progestogens to estrogens. At 8 weeks of gestation, the fetoplacental unit is not yet a major source of progestogens, and therefore dexamethasone will not reliably produce abortion, so we can eliminate this option. Option B, 2 injections of PGF2-alpha given 11 days apart, starting immediately. This is incorrect. Why would we give PGF2-alpha twice with such a long time interval? This option is designed to confuse you with the commonly used protocol that we use for estrus synchronization. Option C. A single injection of PGF2-alpha given immediately. This is the correct answer. At this stage of gestation, if you can eliminate the CL, you can induce abortion. A single injection of PGF2-alpha is adequate to abort a cow at this stage of gestation. Option D. A single injection of PGF2-alpha and a single injection of dexamethasone given immediately. No, this is incorrect. It would be the correct answer if we were trying to cause a late-term abortion in a cow, where the CL and the fetal placental unit served as the sources of progesterone. Option E. A single injection of estradiol benzoate given immediately. This might cause an abortion by stimulating endogenous PGF2-alpha release, but this is not a reliable method. Option F. Intracervical misoprostol given immediately. Misoprostol is an agent that is used for partus induction in women as well as in mares. For this purpose it comes in a gel formulation and is placed in the external cervical os. It's a prostaglandin, so theoretically could induce luteolysis. However, when placed into the cervix of a cow with a fibromuscular cervix, it's unlikely to have the desired effect. It's a method of opening the cervix in mares which have a muscular cervix. Question 6 for 2 marks. Which two conditions are associated with partus induction in cows? A. Hypocalcemia. B. Abomasal displacement. C. Retained fetal membranes. D. Mastitis. E. Dystocia. F. Prepubic tendon rupture. G. Ketosis. H. Puerperal metritis. I. Uterine torsion. This is another simple recall from your notes type question. Let's go through the options. Option A. Hypocalcemia. No, hypocalcemia in bovines is commonly seen around the peripartal period, particularly in dairy cows. Partus induction has no effect on the occurrence of hypocalcemia. B. Abomasal displacement. Displaced abomasums, or DAs, typically present in dairy cows in early lactation. However, there is no association between the occurrence of a DA and induction of partus. Option C. Retained fetal membranes. Yes, this is a condition that is definitely associated with partus induction. The process by which the fetal membranes loosen and detach requires a complex coordination of inflammatory mediators and enzymes which are coded for by a series of signals that we do not completely understand. We do know that if we induce partus artificially, it tends to interfere with a cascade of signals that causes the normal detachment of the fetal membranes, and we tend to have retained fetal membranes. D. Mastitis. No, there's no association between induced labor and mastitis. E. Dystocia. Yes, if we induce labor, there's often insufficient time for softening of the pelvic ligaments and relaxation of the soft tissues of the cervix to form the birth canal. Also, the fetus may not turn into the normal disposition for birth, which is cranial presentation, dorsosacral position, bilateral forelimb extension. If you induce labor in a cow, you need to watch her closely until the calf has been delivered. F. Prepubic tendon rupture. No, this has no association with induction of labor. You can, however, induce labor if you are afraid that the prepubic tendon might rupture, as we do during abnormal pregnancies, such as in the case of hydrops allantoes. G. Ketosis. No, this is another condition of early lactation. It has no association with partus induction. H. Puerperal metritis. Although it could theoretically occur as a sequel to retained fetal membranes and endometritis after partus induction, it's a long shot to assume that puerperal metritis is directly associated with partus induction. I. Uterine torsion. No, there's no association between partus induction and torsion of the uterus. Question 7 for 1 mark. The cow in the picture below gave birth to a healthy calf 3 hours ago. Select the correct option from the list below. This question tests your knowledge of retained fetal membranes in the cow. Remember that in our production animals, retained fetal membranes are of lesser concern than they are in equines. Our definition of retained fetal membranes is the failure to expel the fetal membranes within 24 hours of parturition. So if they are still there after 3 hours, there's certainly not yet anything to worry about. So let's go through the options. Option A, pull firmly on the visible membranes until they detach. Absolutely not. This is a no-no because you will likely tear the fetal membranes and leave a piece behind adhering to the interior of the uterus. Option B, Attempt to twist the fetal membranes into a cord while massaging per rectum. It's only been 3 hours, perhaps this is a little bit of a drastic maneuver. This might be an option later after 24 hours have passed and the condition of retained fetal membranes actually exists. Option C, treat with tetracyclines to prevent infection. No, firstly it's way too early to diagnose the membranes as retained, and secondly, antibiotics may affect the putrefactive process that causes the eventual detachment of the retained fetal membranes. Option D, advise the farmer to observe the cow for the next 24 hours but do nothing at the moment. This is the best answer. Option E, flush the uterus with copious volumes of fluid. This treatment is commonly applied in mares with retained fetal membranes, but it's not often done in cows, so this is incorrect. Question 8 for 2 marks. A cow 2 weeks postpartum has the vulvar discharge seen in the picture below. First question, select the correct description. So if we look at this discharge, it looks like slightly bloody mucus with yellow cheesy chunks of pus in it. So therefore the pathological MD would be A, mucoid. Well, no. If it were mucoid, it would be a clear mucus. B, mucopurulent. Yes, as you can see, this is thick mucus containing chunks of pus. C, watery. No, it's obviously not watery. D, purulent. No, if it were purulent, it would be thicker and yellower and consist only of pus. E, serosanguinous. No, if it was serosanguinous, it would be much thinner like serum and more uniformly blood-colored, which it isn't. F, sanguinopurulent. No, if it was sanguinopurulent, it wouldn't be this thick, and it would be more like cream of tomato soup. The second question is, select the most likely cause. A, pyometra. No, with pyometra in the bovine, the uterus is filled with pus, there's a closed cervix, and there's corpus luteum present. There'd be no such discharge. B, endometritis. Yes, endometritis is the most important and the most common cause of a mucopurulent discharge in the postpartum period in the cow. C, puerperal metritis. No, this is incorrect, because puerperal metritis usually presents with a sanguinopurulent discharge of a large volume. In other words, it's copious, stinking, and a thin mixture of blood and pus. D, estrus. No, definitely not. With estrus we might see a clear mucoid discharge, which we also know as the bull string. E, vaginitis. Vaginitis might also cause a mucopurulent discharge, but this isn't the most likely cause, and usually a vaginitis will just be a plain purulent discharge. F, normal lochia. Well, one would certainly hope that this isn't normal lochia. Normal lochia is thin, mucoid, and slightly bloodied in color. Question 9 for 4 marks. In January, a 13-year-old multiparous commercial beef cow was found to be 2 months pregnant by rectal palpation. At her second pregnancy check in June, her right uterine horn was approximately the size and shape of a watermelon, was hard and non-fluctuant. She had a well-developed corpus luteum ipsilateral to the enlarged uterine horn. No fremitus was palpable in either uterine artery. On speculum examination, her cervix was seen to be closed. Select the 2 correct statements from the list that follows, with 2 marks per correct answer. Okay, so this question is a 4-marker with only 2 correct options. This is a warning that this one might be a little bit tricky, so proceed with caution. In the first paragraph, I'm describing to you the typical presentation of bovine papyraceous fetal mummification. You need to be able to recognize this before proceeding with the remainder of the question. So let's select the 2 correct statements. Option A. Treatment with PGF2-alpha will achieve cervical dilation and expulsion of the uterine content. No. Unfortunately in bovines, treatment with PGF2-alpha will probably cause luteolysis, but will not reliably cause cervical dilation. Option B. The uterine content should be removed by standing flank hysterotomy. This is theoretically an option, but it is a very expensive one. It might be performed in a very valuable stud animal, with the potential for a long and productive life ahead of her. But in this case, I'm careful to specify in the question that she is a 13-year-old commercial cow. Option C. If the uterine content can be removed, the chances of reconception are reasonable. This is correct. Papyraceous mummification does not usually affect the functioning of the ovaries, and nor does it damage the uterine lining. It's getting the mummified fetus out that's the problem. Option D. The cervix should be manually dilated and the uterine content removed. No. Unfortunately, manual dilation of the fibromuscular bovine cervix is near impossible. I myself have tried it on several occasions to encourage partially open cervices to open by spreading the external os with my fingers, all to no avail. In mares, it's certainly possible to dilate the smooth muscle cervix manually. Option E. The condition is heritable. No, not parturition mummification. Hematic mummification, which occurs in Channel Island breeds, has got a genetic component and is therefore heritable. Option F. Treatment is seldom effective and culling is recommended. Yes, for all the reasons I've already given you, it's extremely difficult to treat this condition, and unless the value of the animal is such that surgery is indicated, it's usually best to cut your losses and cull the cow. The presence of a mummified fetus in the uterus will not affect the quality of the carcass. Be careful not to administer any medications that might have a withdrawal period. Option G. The condition is commonly associated with Channel Island breeds. No, the other type of mummification, hematic mummification, is more commonly seen in Jerseys and Guernseys. Option 8. The cow may be systemically ill. No, cows with mummified fetuses in their uteruses are not ill. Option I. If untreated, the condition will result in peritonitis. No, it won't. The mummified fetus will just lie within the uterus and will usually not cause any further trouble. Question 10 for 1 mark. This is a simple looking question, but it really tests your knowledge of the physiology of sperm production and of the breeding soundness examination of the bull. 1 ejaculate was collected from each of 4 bulls earlier today. Each option describes some characteristics of each bull's semen. Select the bull whose semen would most likely improve by collecting at least 3 ejaculates in short succession tomorrow. Bull 1 produced ivory, creamy semen that had 60% morphologically normal sperm and 28% sperm with diadem defects. Ivory, creamy semen suggests that there is a high concentration of sperm within that ejaculate. 28% of the sperm have diadem defects, however. Diadem defects are head defects, so they are issues with sperm production that reflect testicular pathology. Therefore, if we collect 3 ejaculates again tomorrow, it's very unlikely that the condition will have magically improved. Bull 2 had white, milky semen with a mass motility score of 3 and an individual sperm motility of 70% progressively motile. So white, milky semen and a mass motility score of 3 contains relatively low numbers of sperm. The individual sperm motility of 70% progressive suggests that most of the sperm, or 70%, are progressively motile. This is also unlikely to significantly improve if you collect semen again tomorrow. So this bull produces reasonable sperm, but he just doesn't produce very much when you collect him using electroejaculation. So collecting him 3 times again tomorrow is unlikely to improve matters. Bull 3 had white, thin milky semen with a mass motility score of 2 and individual motility of 80% progressively motile. This is not a very concentrated ejaculate. There are relatively few sperm in it. We can see this from the description of white, thin milky, and the mass motility score, but the individual progressive motility is 80%, which is great. So this pool produces very good sperm, he just doesn't produce very much when ejaculated, just like the previous one. Again, this is unlikely to improve with another collection the following day. Bull 4 produces ivory semen with an individual motility of 45% progressive, 5% aberrant, and 50% immotile. And of those, 45% stain red using eosin nigrosin. This bull produces a concentrated ejaculate. We can deduce this from the description of sperm color as being ivory, but the ejaculate we collected has low individual motility. When we look at an eosin nigrosin smear, which, as you should know, is a vital stain, so dead sperm stain red and living sperm don't take up the stain, 45% of the sperm stain red, or are dead. So this bull produced a concentrated ejaculate with a substantial proportion of dead sperm. This suggests that the issue is likely in the storage of sperm in his epididymal tails. The sperm were probably waiting around for a long time and became senile. If we were to collect him again tomorrow, we would probably see a marked improvement as we flush out the dead ones and he replaces them with newly produced sperm. So this last option is the correct answer. Question 11 for 1 mark is very similar to the previous question, but tests another aspect of sperm production. 1 ejaculate was collected from each of 4 bulls earlier today. Each option describes some characteristics of each bull's semen. Select the bull whose semen quality should only be reassessed after 2 to 3 months. Bull 1, ivory, creamy, 60% morphologically normal sperm, 28% sperm with diadem defects. This option suggests an issue with sperm production. The origin of these defects lies in the testes, as we discussed in the previous question. When you get a sperm defect that is of testicular origin, the first thing you should do is examine the testes to see if you can identify any obvious abnormalities. Sometimes there may be, for example, evidence of an orchitis or else soft testes that might indicate premature testicular degeneration. If you can't identify anything on palpation, you might, under certain circumstances, examine the testes by ultrasonography. A very common issue is that the animal experienced a fever due to a disease, so let's say babesiosis, and has a temporary reduction in the percentage of morphologically normal sperm. If you were to examine the animal after at least 1 entire spermatogenic cycle, which you should know in the bull is 67 days, you may well find that semen quality is improved. This bull is a prime candidate for this approach, and that makes this option the correct answer. Option 2, white, milky, mass motility of 3, individual sperm motility of 70% progressive, 5% aberrant, and 25% immotile. Examining this bull again in 3 months is unlikely to show you a significantly different picture. This bull has reasonable semen. He just doesn't ejaculate very concentrated sperm by electroejaculation. If you wanted to see if he was capable of producing a more concentrated ejaculate, you might try collecting semen by manual transrectal massage, or perhaps using an artificial vagina, if he is very valuable and warrants that time and effort to train him to jump on AV. None of these are options in this question, so you can eliminate this option as a potential answer. Bull 3, white, thin milky, mass motility score of 2, individual motility of 80% progressive, 2% aberrant, and 18% immotile. So just as in the previous option, this bull produces semen of good quality when you electroejaculate him. He just doesn't produce very much at all. Testing him again in 3 months is unlikely to change much. Just like in the previous example, if he's very valuable, you might consider collecting semen by another method and see if that has any effect. Bull 4, ivory, with an individual motility of 45% progressive, 5% aberrant, and 50% immotile, of which 45% are red when seen on eosin nigrosin smear. This bull produces good quality sperm, roughly half of them are dead. No defects are mentioned here, so we can assume that the dead sperm are morphologically normal. As discussed in the previous question, this picture is most likely due to sperm senescence, which would improve by collecting semen again shortly after the first collection. Collecting again in 3 months is unlikely to help. To clear out the dead ones, you need to collect them again quite soon, so this is also not an acceptable option. Question 12 for 2 marks. One of your clients is a commercial beef producer. He has just bought a new 18-month-old bull. Another vet issued a breeding soundness certificate for this animal, part of which is shown below. That's important, just part of it. The certifying vet marked what applies to the bull in green. So trichomoniasis, sheath wash or scraping, not done. Number of tests for trichomoniasis, none because it wasn't done. Campylobacteriosis, sheath wash or scraping, not done. And then obviously again, number of tests for Campylobacter, 0. Select the most appropriate option. A. The certificate is not valid as the bull should have been tested for infection with Trichomonas fetus and Campylobacter fetus subspecies fetus. B. The certificate is not valid as the bull should have been tested for infection with Trichomonas fetus and Campylobacter fetus subspecies fetus. The certificate is valid. ensure that the bull is vaccinated against trichomoniasis and campylobacteriosis. D. The certificate is valid. Vaccinate the bull against each of these two pathogens, then test the bull once for each and use him for breeding if the tests are negative. Option E. The certificate is valid. Test the bull 3 times for each of the two pathogens and use him for breeding if all tests are negative. The whole purpose of this question is to test whether you recognize that just because a breeding soundness examination is incomplete, it isn't necessarily invalid, provided that it is specified which tests have been omitted. So let's look at option A. The certificate is not valid as the bull should have been tested for infection with Trichomonas fetus and Campylobacter fetus subspecies fetus. Yes, sure, the bull should have been tested for trichomoniasis and campylobacteriosis, but just because he wasn't doesn't mean that the sale certificate is completely invalid. Also, always double check spelling when it comes to the organisms. There are different spellings of the word fetus, American versus British, and the subspecies are important. In this case, the incorrect spelling of the Campylobacter organism was used. Option B. Option B contains major spelling mistakes of both organisms, so no such organisms exist, so you can eliminate that one immediately. Spelling is so important. Option C. The certificate is valid. Ensure that the bull is vaccinated against campylobacteriosis and trichomoniasis. There are vaccines available for both of these diseases. The campylobacteriosis vaccine can be given to both bulls and cows. However, the vaccine for Trichomonas fetus subspecies venerealis is administered only to cows. Therefore, since we don't vaccinate bulls against trichomoniasis, we can eliminate this option as an answer. Option D. The certificate is valid. Vaccinate the bull against each of the two pathogens, then test the bull once for each and use him for breeding if the tests are negative. Well, this answer is wrong in 2 ways. Again, it wants you to vaccinate a bull for trich, and secondly, it wants you to perform only one test. You should know that testing for trich and Campylobacter is subject to the isolation of the organism or its DNA from the sheath by performing a sheath scrape or wash. The method of sample collection is not very sensitive, so for this reason we collect 3 samples at weekly intervals. If any one of these samples comes back positive from the lab on PCR or culture, we consider the animal positive for the disease. Option E. The certificate is valid. Test the bull 3 times for each of the 2 pathogens and use him for breeding if all tests are negative. This is the correct answer. We can rely on the semen evaluation of the previous vet and just make sure that he is negative for trich and Campylobacter before using him on the herd. Note from the question that the animal is only 18 months of age. This is something that you might encounter fairly often if you work in large animal practice. Before a bull sale, a stud farmer might ask the vet to test the young sale bulls to determine whether they are anatomically normal and produce good quality semen. Because testing for venereal diseases requires 3 consecutive negative tests at weekly intervals, it might take some time before he gets his results, and he wants to have sold the bulls by then already. Therefore, it's acceptable under these circumstances for the vet who does the initial breeding soundness examination to specify that testing for venereal diseases was not performed, and then for the purchaser to have it done at his own cost before putting the bull with his cows. Our tests can be really tricky at times, and they really require you to have a deep understanding of the subject material. I hope that this presentation has been of help to you. If you have any feedback, please feel free to contact me.